Hello, my name is Enos, and this is Work and Wonder, where we talk a lot about the mental health of ski. So I normally use short videos like this to answer some of the questions that you normally ask under the comment section. So I've picked one of them, and then I'll be answering it. So the question was about a diazepam, which is PRN, which is as a required medication, and then she knows that diazepam is a controlled drug, and then the person was asking as to whether you need your assessor to countersign it or not. Now, when we talk about controlled drugs, we can classify them under what we call schedules in the UK here. So we have Schedule 1, where you have LSD, you have Schedule 2, where you have like diamorphine, then we have, Schedule 3, where you have morphine, tramadol, then you go to Schedule 4. Under Schedule 4, that is where you are going to find diazepam, lorazepam, clonazepam. So under Schedule 4, the stringent rules which revolves around like class Schedule 1, Schedule 2, Schedule 3 with regards to procuring them, dispensing them, and even administering them, storing them, does not apply to Schedule 4. When we talk about the Schedule 1 to the Schedule 3, you have to store them in a secure cupboard. When you are taking it out, you need to count it. When you are dispensing it, you need another nurse there to be able to countersign that you've actually given it. All those things does not apply to Schedule 4 medications where you have clonazepam, diazepam apply. So when you are dispensing it or when you are giving it, we normally keep it as part of the normal medications, and then you can just dispense it and then you sign for it yourself. You don't need a second person. With that being said, it normally also depends on the company policies or the trust policies. Some trusts, even though they know that it falls under Schedule 4 and you don't need all these rules around it, like signing for it and storing it, but then they still decide to keep it in the control drug cupboard where if you are taking it out, you need a second nurse to sign it. When you are dispensing it to the patient, you need a second nurse to witness and all of that. But then it is not, you don't need a second person to sign for it. So in your exams, you don't need your assessor to sign for diazepam or clonazepam or lorazepam. When you are dispensing it to the patient, you can just give it straight away and then you just sign for it. If it is put under the PRN and the patient is less agitated or the patient is anxious and you need to give it, you can just give it and then you sign for it. I hope this is clear enough um, for the question that you asked under the comment section.